Hello, Namaskar, and welcome to Apollo 24/7's Health Hour. Health Hour is a show which is designed exclusively to bring experts from Apollo hospitals so that you can ask all those questions that you have been postponing. We know that it is important to get a kind of idea to, even before the physical consultation or that trip to the doctor. I know that it is important to have information, and information is power. That's why we have got this show for you. So, in today's episode, you are going to meet a dermatologist from Apollo, expert dermatologist from Apollo Hospitals International, Ahmedabad. Dr. Pooja Solanki Vyas is going to join us. We are going to talk about how to control hair fall and premature graying. Wow, this is a topic that has been on my mind for a very long time, and I know a lot of you also want to ask questions. Your personal questions will be taken up on this show. You can consult the specialist on Apollo 24/7 app. And today we are bringing you Dr. Pooja Solanki Vyas to the live session. Join us on YouTube chat if you want your query to be answered. You can type it in the YouTube chat box. I shall take up the live questions in a few minutes once the doctor joins us. And also, let me remind you, if you download Apollo 24/7 app, and if you have it already, make sure that the app is updated and refreshed, because we're going to share some gift coupons and I'm going to ask you some the quick quiz questions. There's going to be a quiz. Health hour में health quiz भी होगा, where you can win gift coupons which can be used in Apollo 24/7 app. तो चलिए आज के एक्सपर्ट को हम इंट्रोड्यूस कर देते हैं आपके लिए. डॉक्टर पूजा सोलंकी व्यास is a consultant dermatologist and cosmetologist at Apollo Hospitals International, Ahmedabad. She is experienced 7 years का experience है मैम का, और प्रोफेशनल मेंबरशिप्स है IADVL, that is Indian Association of Dermatologists, Venerologists and Leperologists का. CDSR Cosmetic Dermatology Society of राजकोट में भी इनका प्रोफेशनल मेंबरशिप है. आज डॉक्टर पूजा सोलंकी व्यास has joined us. Good morning, ma'am, and welcome to the show.
Very good morning. Thank you.
यस मैम, हम लोग काफी उतावले हैं, वेट कर रहे हैं आपके लिए, बिकॉज हेयर फॉल एंड ग्रेइंग इज एवरीबडी सब्जेक्ट. क्राउनिंग ग्लोरी तो सबको रहना ही है. तो आई नो यू आर अ डर्मेटोलॉजिस्ट एंड हु कैन बी कंसल्टेड फॉर अदर स्किन इश्यूज एज वेल. बट लेट मी वेलकम यू हियर फॉर आवर टॉपिक ऑफ द डे, हेयर फॉल.
Thank you.
यस डॉक्टर पूजा, क्विकली मैं एक क्वेश्चन पूछूं. सिंपल सा क्वेश्चन लगेगा आपको, पर
Yes.
अगर हेयर फॉल हो रहा है, आई नेवर न्यू दैट आई इनिशियली आई एम टॉकिंग अबाउट, इट वाज सो कंफ्यूजिंग. मैं किसके साथ जाके बात करूं, इसका एक्सपर्ट कौन है, ये हमें पता नहीं होता था पहले. तो आई यूज्ड टू गेट कंफ्यूज्ड. ऑफ कोर्स जनरल फिजिशियन इज द फर्स्ट वन दैट वी यूज्ड टू एड्रेस, बट
Yes.
कौन है एक्सपर्ट जो हेयर फॉल के बारे में बात कर सकते हैं?
Definitely. Dermatologist, trichologist.
अच्छा, डर्मेटोलॉजिस्ट के पास जाएंगे, उसके बाद नेक्स्ट है ट्राइकोलॉजिस्ट है. So,
Trichologist has got specialization in just hair related issues. So dermatologist has got special instrument called trichoscope through which they can examine the hairs. So they are trichologists too.
that's nice, that's nice. Thank you so much for clarifying that, मैम. तो डॉक्टर पूजा अहमदाबाद से है, तो मैम आप गुजराती बोल सकते हैं?
Yes, I can speak Gujarati, English as well as Hindi.
వండర్ఫుల్ మ్యామ్. मैं హైదరాబాద్ से हूँ, तो मैं తెలుగు बोल सकती हूँ. ఆడియన్స్ మ్యామ్ ఏదైతే చెప్తున్నారో నేను అది అప్పుడప్పుడు మీకు తెలుగులో కొంచెం ట్రాన్స్లేట్ చేస్తాను. అండ్ డాక్టర్, इन केस दैट यू फील लाइक समिंग अप इन गुजराती, एंड आपके गुजराती व्यूअर्स अगर कोई है, आप उनके लिए गुजराती में भी बोल सकेंगे. बट प्रिडोमिनेंटली आज के क्वेश्चन आंसर सेशंस एंड इन्फॉर्मेशन हम इंग्लिश एंड हिंदी में रखेंगे मैम, इफ दैट्स
Sure. Yeah.
Yeah?
Definitely.
डन. तो पहले मुझे ये पूछना था कि हेयर फॉल, जैसे हेयर बढ़ता है, वी ऑल नो दैट हेयर ग्रोस एंड
Yes.
ऑल्सो फॉल्स. व्हाट इज
Yeah.
नॉर्मल एंड व्हाट इज नॉट नॉर्मल?
See, hair is made up of a special protein. Okay, so it is basically a protein called keratin. So hair undergoes a cyclical phase of growth and rest. So that is called hair cycle. So there are three phases of hair cycle, like anagen phase, which is the phase of active growth. So 90% of our scalp hairs are in anagen phase through any period of time. Then comes the catagen phase, which is the involution phase, and next is the telogen phase, that is the resting phase. So in telogen phase, yeah, after the telogen phase, the hair follicle just is extruded out and the new hair cycle begins. So this is all about hair cycle. So we all, our hair passes through these three stages.
तो जब से पैदा होते हैं तब से ये स्टेजेस होते हैं?
Yes.
वाओ! तो
Yeah.
ये
So
इन द सेंस कि थोड़े ये स्टेजेस में डिले हो सकता है या
yeah.
थोड़ा ज़्यादा लंबा हो सकता है? इज़ दिस दैट्स व्हाई थिनिंग ऑफ द हेयर? वैसे मेरे बालों के तारीफ वहाँ पर हो रहा है, नो, 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 दिस इज़ ऑल शूटिंग के लिए जो बना हुआ बाल है, बट सच्ची में मैं बोलूँ तो आई एम फेसिंग सिवियर हेयर फॉल मैम। तो
Yeah.
इतना स्लो होता है अभी ग्रोथ। इनिशियली इट यूज्ड टू ग्रो रियली फास्ट, नाउ आई एम एक्सपीरियंसिंग वेरी स्लो ग्रोथ। Do you think there's a reason behind this?
Yeah, first and foremost, it is very much important to know the cause of your hair fall. Only then appropriate treatment could be started. So,
Okay.
history and clinical examination both are required in order to understand the cause of your hair fall.
Okay. Okay. So, TK ma'am, I understand that अगर hair fall is different in each and every person, factors क्या हो सकते हैं? What are the factors that influence hair growth or hair fall?
Yeah, see, first and foremost factor is genetics. Okay,
अच्छा.
there are certain genetic disorders in which there is whitening of hair, or there are certain aging syndromes also in which there is premature graying of hair, and certain environmental factors are there like pollution, ultraviolet rays. Then stress is also one of the very important factor of hair fall. Like post COVID also, people have undergone a lot of stress, so that is
Yeah.
also one of the factor. Oxidative stress, then certain medical conditions like hormone related issues like hypothyroid, hyperthyroid, or some Graves disease, diabetes, alopecia, so smoking and alcohol consumption, and then certain
अच्छा.
use of hair products and hair treatments, overuse of hair products and hair treatments can also cause hair fall. It is also seasonal, like it is very much common between July to October month, so that seasonal hair fall is also seen.
Oh, that is something there. I'm sorry to get my pets into picture. हम जो भी पेट पेरेंट्स है वो तो एक्सेप्ट करेंगे कि पेट्स का शेडिंग सीजनल होता है। ये मुझे पता नहीं था कि ह्यूमंस में भी हेयर फॉल सीजनल होता है।
Yeah, it is seasonal also.
Oh really? And which is the time that you said, ma'am?
Between July to October month.
अच्छा,
In
जुलाई टू अक्टूबर में हेयर फॉल ज्यादा होता है। तो ग्रोथ भी बराबर वैसे ही रेशियो में आता है या झड़ते हुए बालों का रेशियो ज्यादा होता है, बढ़ते हुए बालों का रेशियो कम होता है? दिस इज व्हाट आई ऑब्जर्व्ड।
yeah, actually there is hair fall is more evident. So actually the hair growth is taking place, but it is not so evident. So you will feel that the hair fall is seen more during these months. You know,
हाँ, करेक्ट।
rate of
सो
growth is
जो
there, but shedding is more. Yeah.
करेक्ट, करेक्ट, करेक्ट। तो मैम वन मोर क्वेश्चन, जो प्रीमेच्योर ग्रेइंग का टॉपिक आपने लिया है, तो ग्रेइंग कब से शुरू होना चाहिए? एंड बच्चों
Yeah.
में अगर ग्रेइंग दिखता है या वेरी यंग अगर ग्रेइंग शुरू होता है, क्या रीजंस हो सकते हैं?
Yeah. See, graying is a normal physiological process. So it is normally seen after 35 to 40 years of age. But it is called premature graying or premature keratitis when it occurs at an early age, like before the age of 20 in white population, before 25 years in Asians, and before 30 years in African population. So it is called as premature graying.
यस, यस, यस। तो प्रीमेच्योर ग्रेइंग के रीजंस क्या हो सकते हैं मैम?
Yeah. So premature graying is again seen due to certain nutritional deficiencies. Like in children, they opt for a lot of junk food, and also there is vitamin deficiency. Could be one of the reason for premature graying. Like we can see patients very young at the age of 17, 7, they start graying. There's
यस,
graying
यस,
of hair.
वेरी
So
यंग।
very young age it is seen, like due to vitamin, they're deficient in vitamin B12 and certain trace elements and minerals which are required for healthy hair and growth. They're also deficient in that, like iron,
जी,
calcium, yeah, selenium, zinc, copper. All these are vitamins and minerals are very essential for hair. So and other things are stress, and there is due to pollution, environmental factors, there is generation of free radicals in our body. So our body uses antioxidants to neutralize these free radicals, but sometimes it is not able to counteract that, and because of that there is damage to the melanin which is present in the hair.
यस।
Melanin is a pigment which is present in the hair. So
जैसे
due
स्किन
to
में होता है वैसे हेयर में भी होता है.
yes, yes. So these are the
Okay.
factors. Yeah.
Something interesting that you just now raised a very very important topic, कि environmental factors जो which are not in our control. See, hereditary factors हो सकते हैं और other nutritional deficiencies are in our hands. So there are
Yeah.
something that we cannot control. So what is the kind of the era that we are living in? What are the environmental factors which are affecting our hair growth, hair fall, and also premature graying? Does it have an effect?
Yes. See, pollution
हाँ.
and then ultraviolet rays. So consumption of junk food. So all these things, environmental factors, they cause premature graying. Because of this, there's generation of free radicals, as I already told. So there is reactive oxygen species which are generated in our body, and our body tries to counteract it by antioxidants. But sometimes these antioxidants are not sufficient enough. So it will lead to damage of process of melanogenesis and melanin synthesis.
जी. तो I understand that there are hereditary reasons, there are health reasons, there are environmental reasons,
Yeah.
and are there any other health conditions which are affecting our hair growth and hair fall? Is it
Yeah.
trying to tell अगर hair fall ज़्यादा
Yeah.
हो रहा है या suddenly acute hair fall हो रहा है? Is it trying to tell me an indication, give me an indication about the underlying health condition, ma'am?
Yeah. See, if you talk about premature graying, then certain medical conditions associated with our atopic dermatitis, in which the skin is very much red, it is inflamed, and certain autoimmune disorders such as alopecia areata, in which there is a bald patch which is seen on the scalp.
Yes.
Yeah, it could be due to diabetes, and hypothyroidism is also one of the causative factor. Then sometimes due to malabsorption also, like we are consuming enough of nutrients, but due to some
Hmm.
malabsorption in our malabsorption syndromes or celiac disease, our body is not able to absorb those nutrients, so it could also result in nutritional deficiency.
Okay. Okay.
Yeah, so that
So,
is also one of
so,
the reasons.
so we also see. I know I'm getting to the extreme of it, but certain cancers and treatments,
Yeah,
hair
yeah,
fall भी हो
yeah,
सकता है. ये-
yeah,
So
certain
treatment
drug.
के बाद जो होता है वो अलग है. But are there anything else कि अंदर एक बीमारी है और बाहर से बाल झड़ने वाला एक कोई condition है क्या? Or is it trying to tell me that please go check this and get a test done?
Yeah, see, like vitamin deficiency B12, you need to get your hemoglobin levels checked first and foremost, because most of our Indian females are very much iron deficient. So you should
जी.
always get your hemoglobin levels checked. Okay, vitamin B12. So most of the population are here. They are very pure vegetarians. So we get very little of vitamin B12. So sometimes
Yes.
B12 deficiency is also one of the reason. And chemo, like
Mm-hmm.
drug intake, like chemotherapeutic drugs, anti-cancer drugs, and then anti-malarials, they are also known to cause hair fall.
जी, thank you so much for putting this in place, ma'am. And quickly एक और question पूछना था कि जो while thinking that vitamin deficiency है और हम लोग pop in करते हैं supplements और मार्केट में इतने सारे products बेचते हैं hair growth के लिए और repair के लिए. What is your take on such supplements which are promoted as hair growth supplements, and who should take it?
Yeah, you should always consult a dermatologist before taking those supplements, because one actually a person does not know that what is the exact cause of hair fall. So just consuming those nutrients and having adequate, like nutrition, no deficiencies there, then I don't think it is of much help. So first and
जी.
foremost is you need to find out the cause, and if you treat the cause, then only your hair fall would be controlled.
And what is the role of diet, ma'am? I think मैंने observe किया है कि if I'm going bad with my intake, certain nutrient intake, I observe that in a month I have a increased hair fall. So is there a
Yeah.
direct relation to hair fall and diet, ma'am?
Yeah, see, crash diet. Then whenever you are deprived of protein food, whenever you are intake of green leafy vegetables and everything is reduced, then there is very much possibility that you will have increased hair fall. So always you need to take protein rich food, even though if you are on diet, then at least in a week, 3 days you need to take pulses, nuts, eggs, green leafy vegetables, carrots. All these are rich source for which are
Okay.
required for hair growth.
Yes, a lot of people have started asking questions, ma'am. I'll take the questions shortly up. I generally wait for 10-15 minutes for people to sign in and ask their questions so that, they will also understand what to ask and how to ask. So now we have enough questions. I'll start taking questions. But just before that, ma'am, one quick question about coloring of the hair. I've
Yeah.
observed in the initial days when I started to color my hair, not completely, but to get those streaks and other colors that I've added, I see that suddenly graying शुरू हो गया एकदम
Yes.
से जब मैंने कलर बंद किया तो now I've let it go. I said okay whatever is growing it's growing, but uh, in order to hide the graying अगर मैं कलर करवाती हूँ तो वो तो और मुझे ग्रे करवा रहा है. Is this a lobby or a cycle? Am I being attracted into this vicious cycle?
So whenever there is graying or whitening of hair, the solution to cover up your gray is hair coloring, definitely. But you need to wisely choose your hair colors, because these
जी
are even these are natural, and as well as they are artificially synthesized. So those which are artificially synthesized contains a lot of harsh chemicals that damages your hair follicle and melanin. So that would again aggravate your, like, graying of hair. So instead of that, go for natural hair colors which are organic and which are botanical extracts. So
जी.
that would be helpful more.
Okay, so let me start taking questions. Something that caught my attention is हम लोग काफी all of us try doing different things to stop hair fall or do something or the other. कभी ना कभी कहीं ना कहीं तो कुछ तो कर चुके होते हैं and trial and errors तो होते ही रहते हैं हमारे साथ. अनुषा केसरवानी जी पूछ रहे हैं My hair fall is not stopping and this is not seasonal. And
Yeah.
she must have tried multiple things. So, what is your suggestion, ma'am?
Yeah, so it depends on many things, like whether how tightly she ties her hair, or how
अच्छा
much. Yes, it could be
अच्छा
like.
so जो जो टाइट हेयर स्टाइल्स बना लेते हैं या घुमा फिरा के करते हैं इसके
Yeah,
साथ भी प्रॉब्लम है.
yeah, it causes traction on your hair, so it damages your hair shaft. So you need to, like, during such season, during warm and humid conditions, you need to put a loose ponytail or loose bun, so that water is trapped less in your hair, and sometimes it could be also one of the reason.
So, ma'am, I'll quickly sum this up for the audience who are watching it in my language, Telugu. I speak Telugu, so let me quickly tell them. జుట్టు గట్టిగా ఆడవాళ్ళు జడ వేసుకుని టైట్గా పోనీటైల్స్ వేసుకుంటే కనుక అది టెన్షన్ ట్రాక్షన్ క్రియేట్ చేసి అక్కడి నుంచి మాత్రం జుట్టు రాలిపోయే అవకాశం ఉంటుంది. అప్పుడప్పుడు వదలండి పర్వాలేదు, ఇట్స్ ఓకే, కొంచెం లూజ్గా జడ వేసుకోండి. ఆల్రైట్, సో మ్యామ్ एक और क्वेश्चन यहाँ पर दिख रहा है. श्रीनिवास नहीं नहीं श्रीनिवास जी नहीं, श्रीकांत नायडू, बाल गए तो वापस आ सकते हैं क्या?
Yes. Yeah. See, it depends whether there is a localized patch or it is generalized. If it is localized, then it is alopecia areata. So sometimes it is due to some autoimmune conditions. So you need to, doctor will give you certain medications like steroids and all to put over that bald patch, and it would regain. If it is generalized, then we need to assess the cause. Then whether it is telogen effluvium, when there is, sudden shedding of hair which is seen after any stressful event, 2 to 3 months later. So we need to see what type of hair fall, like, it is, whether it is localized or generalized.
Yes, ma'am, I'm seeing that a lot of people are asking about shampoos. I'll take their names in a while. But कौन से shampoo use करना चाहिए और कितना use करना चाहिए? एक बार आप you give us some kind of thing and I'll quickly get their questions in person. Yeah.
Yeah. you should always use a milder shampoo, and you should not use too much of harsh chemical shampoos which are very much harsh, and you should not lather it too much to foam, your hairs. The only purpose of shampoo is to just remove the dirt and sebum from your hair. So you should not overuse, and it also depends on the type of hair that you have. With If you have oily scalp, then you might need to wash your hair every day. But if you have got a very dry scalp, then twice or thrice a week would do. And you
Yes.
should,
So,
yeah,
मैम तो ब्रांड नहीं बताएंगे, बट माइल्डर
yeah,
शैम्पू क्या होता है, एंड देन एडिशनल इंग्रेडिएंट्स जैसे मिस्टर फरहाद हुसैन पूछ रहे हैं, व्हाट डू यू सजेस्ट एज अ शैम्पू मैम?
yeah. So any shampoo that is sulfate free shampoo or paraben free shampoo, you should use that type of shampoos. They are mild, gentle cleansers.
सो सुने होंगे पैराबेन फ्री, सल्फेट फ्री होता है.
Yes.
कैन आई क्विकली आस्क अबाउट द नेचुरल क्लेंजर्स मैम? रीठा या सोप नट्स जो बोलते हैं, कुंकुड़ कायलू मेरे लैंग्वेज में बोलते हैं, आपके लैंग्वेज में व्हाट डू यू कॉल देम मैम? रीठा?
Yeah, sorry, only.
Rita only. So I tried Rita, henna, and then hibiscus leaf for a while, but hair बहुत dry हो जाता है मैम उसके साथ. What is your opinion on it?
See, like henna and all, they are very they cause your hair to dry up. So that would cause more dryness of hair, and that could be one of the reasons that your hair is shedding more. But you can prepare a cocktail of amla and honey and egg and yogurt and everything, and you can apply it. It is sort of hair mask that you can use at your home.
Great. So you do suggest कि natural hair masks are good for health. हाँ,
Yes.
तो డాక్టర్ గారు తెలుగులో ఒకసారి మళ్ళీ చెప్పింది తెలుగులో ఒకసారి మళ్ళీ చెప్తాను. ఆమ్లా అంటే ఉసిరికాయ, ఎగ్, యోగర్ట్ అంటే పెరుగు, అండ్ హనీ తేనె, ఇవి కలిపి మీరు మాస్క్ లాగా వేసుకోవచ్చు, హెయిర్ కి ఇంట్లోనే తయారు చేసుకోవచ్చు అని చెప్పారు. మ్యామ్, వుడ్ యు వాంట్ టు సే దట్ టు యువర్ గుజరాती వ్యూअर्स as well?
યા આપણે ઘરગથ્થુ જેમ કે આમલાનું એક એવું મિક્સચર પ્રિપેર કરીએ જેમાં આમળા હોય, હની હોય, એગ્સ હોય, આ બધું મિક્સચર એક પ્રિપેર કરીને આપણે વાળમાં લગાડી શકીએ. સો એનાથી વાળ ખરતા થોડા ઓછા થાય છે, કેમ કે આમળામાં વી ગેટ એન્ટીઓક્સિડન્ટ્સ. ઇટ ઇઝ રિચ સોર્સ ઓફ વિટામિન સી. સો દેટ ઇઝ ઓલ્સો વેરી મચ હેલ્પફુલ ફોર હેર ગ્રોથ.
Thank you, ma'am. Here's Arundhati Kumar's question. 58-year-old, and the hair is thinning near my forehead. Is there anything I can do to stop this hair loss? Kindly advise. So I would want you to throw light on the areas of hair thinning. किसके कहाँ hair thin हो सकता है and क्यों होता है?
Yeah, she is a female of like age.
58.
Okay, so thinning of frontal hairs. It could be female pattern baldness. So in which there is a central thinning of the part. There is thinning of the this parting areas is seen. So there is
कि
central
मांग
thinning.
निकालते पापटी
Yes.
बोलते हैं हम उसको तेलुगु में. हाँ,
Yes.
that also thins quite a bit.
थिन हो जाता है, ठीक है, वहां पे थिन होता है. फिर उसके अलावा इट माइट बी इवन ओवर वर्टेक्स रीजन, इट माइट स्प्रेड, पर वहां से वो थिन हो जाते हैं. सो इट कुड बी पोस्ट मेनोपॉजल आल्सो, and it is due to certain hormones that female pattern baldness is seen, and it is hereditary also.
G G. So can that be tackled, ma'am? Can that
Yeah,
be helped?
yeah, it can be helped by appropriate use of certain hair peptides, hair growth factors and all. So a little bit it can be reversed.
तो वो कहाँ कर सकते हैं? Do we have to meet the dermatologist to take care of that, or over the counter होते हैं क्या?
No, first you need to consult a dermatologist so that they will exactly find whether it is female pattern baldness or it is something different. Then if it is female pattern baldness, then appropriate medicines and topical formulations would be advised.
I'm going to come back to the topical formulations questions, because a lot of them are asking about minoxidil, ketoconazole, and a lot of other topical solutions. I'll come back
Yeah.
to those questions. I'm watching all of them typing that down there. But next question I'm going to take is Geeta Tandon ji पूछ रहे हैं, PCOD भी hair fall का cause हो सकता है क्या?
Yes. So PCOD is basically a syndrome which comprises of amenorrhea, उसमें menses का problem होता है, infertility होता है, weight gain होता है, and there is growth of hairs over the chin and beard areas, and there is hair fall. So it is a component. It is a syndrome which comprises of
हाँ.
all these things. So a hair fall is also a part of that.
ओके ओके तो वंस यू कंट्रोल, तो हेयर फॉल का कंट्रोल वहां पर प्राइमरी नहीं होना चाहिए. कंट्रोलिंग द पीसी, द पॉलिसिस्टिक ओवरी शुड बी द मेन अप्रोच टू दैट.
It's a multi approach. You need to consult gynecologist, endocrinologist, along with dermatologist, so that every part of that component is taken care of.
Super, ma'am. Thank you so much. Because it is not just the hair we're worried about. There are a lot of other
Yeah.
factors. Okay, next question. Anirudhya Sahu. Now that we talked about female button hair loss, here's a question about, ma'am, how to stop genetic hair baldness in men.
Okay, so genetic male baldness is also called as androgenetic alopecia, in which there is loss of hair from this frontal area, parietal, and temporal areas. So it is hereditary, and it is mostly due to hormonal imbalance. So there is overproduction of there is conversion of testosterone to dihydrotestosterone, which is the active metabolite that is actually acting on the hair follicles. So we need to give some topical formulations that would stop this conversion, and so hair follicles, yes.
So, does it make sense to consult a dermatologist very early, the moment you observe that there is a pattern? Will
Yes,
it
the
help?
earlier you consult, the better the results.
గ్రేట్. ఎంత తొందరగా మీరు బట్టతలలాగా కనిపిస్తుంటే హెయిర్ ఫాల్ మెల్లగా స్టార్ట్ అవుతుంది అనుకుంటే, ఎంత తొందరగా మీరు కన్సల్ట్ చేస్తే అంత బెటర్ రిజల్ట్స్ ఉంటాయి అని డాక్టర్ పూజ చెప్తున్నారు. వండర్ఫుల్ మ్యామ్. మ్యామ్, హియర్స్ అనదర్ క్వశ్చన్ అబౌట్ బియర్డ్ గ్రేయింగ్ అండ్ చెస్ట్ హెయిర్ గ్రేయింగ్. 30-year-old మేల్ है, कार्तिक है.
Okay, so see, beard graying is also due to this graying of, it is cannitis only. It is graying of hair. So those gray hairs which are present in the beard areas, they are coarser and they are stiffer and they are difficult to manage, and they grow at a faster rate as compared to pigmented hairs. So you could see
अच्छा,
graying more. Yes, you could see graying more over these areas because their rate of growth is faster as compared to other pigmented hairs. So
वेरी इंटरेस्टिंग.
yeah. So
काश काले बाल भी इतने इतने फास्ट ग्रो हो सकते हैं मैम.
that is true.
Yes, ma'am. So, what can be done to reverse this? Can this be reversed? First point. Can we promote the black hair thing, growth?
See, reversal of graying hair is not very easy, and it depends on the cause. First, it depends on the cause. If you treat the cause appropriately, reversible pigmentation is possible. Reversal, somewhat pigmentation could be achieved, but it is not possible to repigment the depigmented hair.
Hmm. ठीक है. But yeah, so as I was saying, जो सफेद बाल है वो जल्दी बढ़ते हैं. But काले बालों को जल्दी बढ़ा सकते हैं क्या? In case that there is a lot of gray hair which is growing, at least restoration of काले बाल हो सकते हैं क्या?
No, we have to try to stop the graying of hair which is already pigmented. We need to
Ah.
focus on stopping the process of normal conversion of pigmented to graying of hair. So we need to focus on that rather than increasing the pigmented hair ratio.
Yes, I think Karthik, you need to consult Dr. Pooja Solanki. That'll be a good thing. Immediately consult karo and stop the growth of gray hair. Reversing के chances है वहाँ पर. All right. Next question that I want to take is Mr. Archit Singh's, how to limit hair fall because of hard water. जहाँ हम लोग रहते हैं वहाँ पर अगर पानी हार्ड है या salty water, chlorinated water है, will that
Yeah.
affect the texture and the growth of hair, ma'am?
Yeah, hard water, it causes more hair fall. You can use RO water or purified water in place of harsh water for washing your hair. That is
अच्छा,
my
अच्छा. या पहले जब हम लोग बाहर जाते थे, स्पेशली ऑन माय शूट और वर्क, जब हम लोग थोड़ा सा पानी पूछते थे, फिल्टर वाटर, आरओ वाटर टू वॉश द हेयर, हमें बताया जाता था ये हीरोइन वाले नखरे कर रहे हैं तो नहीं तो दिस इज फॉर एवरीबडी. आई एम सो ग्लैड. थैंक यू जी. Next question I want to do is Neha, Chandra and lot of others are also asking uh, how to control hair fall.
Okay.
I know you
See,
have also given us tips, but this is one general question that a lot of people are asking.
the general advice that I would give to control hair fall is some hair tips. Like you should not try to comb your hair when it is wet, because
Okay.
wet hairs are most vulnerable, to damage. So when the hairs are wet, you should not try to comb your hair, and you should always use wide brush for combing your hair.
Okay,
You
so that's a
should,
general tip.
yeah,
Very, very
general.
important. Let me
Yes.
quickly do that in Telugu for the audience who are watching it. Telugulo చెప్తున్నాను. హెయిర్ ఫాల్ అవ్వకుండా మిగతా రీజన్స్, అదర్ రీజన్స్ ఏమైనా ఉంటే ఐడెంటిఫై చేయించుకోండి. ఏ అదర్ రీజన్ లేదు, మీరు హెల్దీగా ఉన్నారు అనుకుంటే కనుక పాటించాల్సిన రెండు ముఖ్యమైనవి: తడి జుట్టుని దువ్వకండి. తడిగా ఉన్నప్పుడు జుట్టు దువ్వినట్టయితే కనుక వీక్ అవుతాయి. రెండోది, వాట్ ఈస్ ద సెకండ్ వన్ మ్యామ్? ఐ ఫర్గాట్. ఫస్ట్ వన్
You
వాస్
can wide comb. Always use wide.
వెడల్పు పళ్ళ దువ్వెన వాడండి. సన్నటి పళ్ళ దువ్వెన వల్ల ఎక్కువ జుట్టు రాలిపోయే అవకాశం ఉంటుంది. థ్యాంక్ యూ మ్యామ్.
And
ఎస్ యూ.
you should always use a mild shampoo and conditioner. Conditioner is also required along with shampooing, because conditioner protects the moisture content of your hair. It tries to preserve the moisture content. So you should always use a mild shampoo along with conditioner.
Yes, Ramya is asking a wonderful question. Ramya, I wanted to ask this question, but because your question has appeared first, let me take your question. Which is a good ingredient to add into hair oil, and shampoo, should it be changed regularly?
uh, in hair oil, I would prefer coconut oil. Coconut oil is best, you can always apply. And you need not frequently change your shampoo. As I said, any shampoo that is sulfate free or paraben free, you can use it for a long time.
मैम अभी कोकोनट ऑयल में आई रिमेम्बर माई ग्रैंडमदर हु यूज्ड टू mix a lot of herbs into oil and boil and then store and give me the oil. मैं तो नाटक करती थी ऑयल लगाने के लिए, काफ़ी भागती थी thinking that it is not style. तो what is your advice? कितने बार हमें चम्पी करना चाहिए या नहीं करना चाहिए? बालों में तेल कब लगाना चाहिए? कितने दिन और कितना टाइम रहना चाहिए? What is your expert advice?
See, it depends on the type of, scalp you have. If you have an oily scalp, then you should wash your hairs 3 times a week, and only before washing, 1 to 2 hours prior, you should oil your hair. And if you have a
अच्छा.
very dry, yeah, if you have a very dry scalp, then you can put oil. You can if you have dry hair, then you can use oil, but that should not be for a very prolonged period, because if too much of oil is there in the scalp, it also favors growth of fungus, and then you will have dandruff and other problems like folliculitis and all. So it is not advisable to keep your hair oily, or putting too much of oil would be of any help for control of hair fall.
ओके मैम, रितु बजाज एंड प्रीति सिंगला दोनों का मैं क्वेश्चन एक ही साथ पूछना चाहती हूँ बिकॉज दे आर आस्किंग अबाउट सप्लीमेंट्स. रितु बजाज इज टेकिंग बायोटीन एंड केराटिन फॉर हेयर फॉल. इज इट गुड फॉर कंट्रोलिंग हेयर फॉल? एंड प्रीति इज आस्किंग मैम, आई एम टेकिंग एडगेन प्लस फॉर हेयर लॉस. ये दोनों तो सप्लीमेंट्स के बारे में बात कर रहे हैं ना मैम? सो विल दिस हेल्प एंड हु हैज टू टेक सप्लीमेंट?
Yeah, both these supplements are good for hair growth. Biotin, as well as all other adgin, which contains vitamins, trace elements, minerals. So from supplement point of view, they both are okay for growth of hair, but we need to assess the cause, as I already said, that whether their hair fall is due to nutritional deficiency. If it is due to nutritional deficiency, then these things would help, otherwise it would not.
All right. So hair to ही लेना पड़ेगा, and then to get that checked, there are quite a number of tests that you can take. Apollo 247 also gives you an opportunity of booking your lab test and also consulting Dr. Pooja Solanki Vyas online as well. Ma'am, here's a question. Al Kaswa पूछ रहे, I have thyroid hyper. नहीं, 125 mcg ले रहे, hyper नहीं, hypo हो सकता है then. तो इनका हेयर फॉल अभी भी है तो क्या सपोर्ट कर सकते हैं? दिस इज इम्पॉर्टेंट बिकॉज आई एम ऑल्सो गोइंग थ्रू hypothyroidism and my hair is also thinning quite a bit.
Yeah. So thyroid issues could result in hair fall. Then taking adequate supplements would help.
Yeah. So what
Or
kind of supplement? Huh.
yeah, it is just biotin supplement along with hormone therapy like anti-thyroid medications which are already going on, along with that nutritional supplement and good and healthy diet and lifestyle would do.
Hmm. ठीक है मैम, so I will concentrate a little more on my nutrient intake there.
Yes.
Yes. Abhinav Bharadwaj ji, wife is taking Emixia and ketoconazole shampoo. Hair is badly damaged. What should I do? Ma'am, can shampoos, especially medicated shampoos, do this rough texture and can they damage hair?
See, Emixia, it is a sort of hair peptide, and ketoconazole is used for dandruff. So, using both, I think first, whether the cause of their hair fall is due to some underlying scalp condition like dandruff, or is it due to some telogen effluent or any stressful situation, then accordingly we can give.
Ah, ठीक है. So there is a reason for giving that, and there is something else. But I also have observed that certain amount of heat that I apply on my hair
Yes.
while I'm sitting here with bouncy hair, I apply a lot of product and then thinking that it's going to help my hair. But heat is heat, no, ma'am. So
Yes.
I see my hair is damaged over a period of years.
Yes, too much use of hair products and hair treatments also damages hair. And heat, like overuse of heat for hair treatments, it damages the shaft of your hair and it results in breakage. So you should always use hair protection spray if at all needed for before curling or before eye straightening. If at all required, then heat protection sprays should be used, and it should be used occasionally and not usually. For even blow dryer and all is not very much advisable for drying your hairs.
G, G. And quickly, ma'am, is there a connection between diabetes and hair fall and thinning, ma'am? Umed Ramji पूछ रहे हैं, how can we stop hair fall in patients with diabetes and thyroid?
Yeah. Whenever it is a part of other syndrome, whenever hair fall is also due to some other medical conditions, treatment of that medical condition along with dermatologist opinion would control hair fall. So
Thank
because
you so much.
yeah, insulin resistance could also be one of the reason. So along with medication, some lifestyle changes like weight reduction, and then stress management, and then other medications for diabetes like metformin and all would help. Together approach would help.
Nice, nice, nice. So here's an interesting question, ma'am. Dhruv Krishnamurti ji पूछ रहे हैं, the son is 17-year-old and hair fall is really very heavy and I'm able to see his scalp. इतने thin हो चुके हैं. So 17 is quite young. Do you see any underlying issues, ma'am?
Yeah, see, first we need to know what is like how much obese he is. Obesity could also be one of the factor. Whether he is
Oh,
taking lot, yes. Because of obesity, there are many things that in our body. There is insulin resistance, hyperinsulinemia. So body is not able to metabolize certain things. So that could be also one of the reasons. So what is his weight, and whether he is taking there is more consumption of junk food. We all need to address those issues.
very, very important point, ma'am. Weight management and hair fall. This is a very important topic, and I think we'll come back to that a little while later. A lot of people are asking about hair colors. हमने थोड़ा सा बात किया है hair color के बारे में पहले भी, but let me get back to those questions. Gopal Reddy, Nagi Reddy, hair color, is it safe or not? Ma'am, Dharmendra Kumar is 27-year-old, beard is grey, and color, is it safe? Then Sri Lata is 34-year-old female having white hair covering with hair dyes and henna. Will there be a problem in future? Is there any other good solution?
Yeah. See, graying of hairs can be covered up only by hair colors. So hair colors, as I already told, it could be it could be natural products or it could be artificially synthesized. So natural colors are prepared from henna, and then all this henna is good as such, but it causes dryness of hair. So, and it does not match the original hair color. Sometimes we get that reddish hue because of that
Tinge,
henna.
color.
Yeah, yes. And the artificially prepared ones, the artificial synthesized ones, they cause more hair damage. So they cause damage to the melanin pigment which is present in the hair. So occasionally it is good to use, but you should not use it regularly. And it could be also temporary or permanent hair colors. So you should always go for semi-permanent ones and not for permanent hair colors.
Oh, that's a very, very important point, Mom. Thank you so much. So, as in continuation with that last 17-year-old, here's a teenager's question. Kshitij is a teenager. What can be cause for severe alopecia in a 17-year-old male?
Whether alopecia, as I already told, alopecia is loss of hair. So whether it is localized or generalized, first we need to assess the scalp as like it could be scarring or non-scarring, because sometimes due to repeated inflammation of scalp there could be scarring. So that at that time it is very much difficult for the hair follicles to again regenerate. So it could be cicatricial alopecia in which there is scarring due to repeated inflammation due to folliculitis. So we need to address those issues as well.
ओके, ज्योति नरूला जी, ऑयलिंग के बारे में थोड़ी देर पहले हमने बात किया था. यू कैन ऑल्सो गेट बैक टू दिस लाइव आफ्टर द शो इज डन. रिकॉर्डिंग भी अवेलेबल होगा. यू कैन गो बैक. ठीक है. एंड देन जय भारती कन्नन मैम, हाउ टू डिफरेंशिएट बिटवीन अ हार्श एंड माइल्ड शैम्पू, इसके बारे में दिस ऑल्सो इज ऑलरेडी टॉक्ड अबाउट एंड यू कैन गेट बैक. Let me come to the question about minoxidil. I told you about the supplements that I'll take. Namrata and Tarun, both of them are asking how safe is this and who should be using minoxidil. And let me first ask you, what is this minoxidil?
Yeah. See, actually, minoxidil was used before. Previously, it was used for the treatment of hypertension. So, it is an anti-hypertensive medication. But the physicians observed that after oral intake of minoxidil, they observed hypertrichosis. That is, there is excessive growth of hair in other body areas. So, this led to the formulation of topical minoxidil. That why can't we use for hair? So, there is
Acha.
formulation of, yes, topical minoxidil for hair. So it is basically a vasodilator. It dilates the blood vessels, so there is improved blood flow to the hair follicles. So it promotes hair growth.
Acha, so that is minoxidil, but kisme ye फायदा होगा? Who will see the benefits if you use minoxidil, and who should be using it? And definitely must be under guidance only, no ma'am.
Yeah, yeah. So any patients who is having androgenetic alopecia, like as I said, androgenic or female pattern baldness, or even if it is alopecia areata in which there is localized hair loss, patch of hair loss, they would be benefited.
ठीक है. So here's AB's question. My hair fall isn't genetic. I had severe hair loss after COVID in January 2022. It's continued since then. I have issues of stress and dandruff as well. Should I start minoxidil?
Yeah. So whenever see post-COVID hair loss is a very common finding, because the lot of stress has occurred, physical as well as mental. So there is hair fall is but obvious. But if there is an issue of dandruff along with hair fall, then first we need to address dandruff. First we need to give them shampoos which control their dandruff, and then we can switch over to minoxidil based preparations.
I'm asking you Mr. Chakraborty's question here, which is in continuation with your dandruff issues. As soon as winter starts, he gets very heavy dandruff. And how can we prevent it?
Yeah, regular oiling of the scalp could prevent dandruff, because in winter there is very much dry scalp. Means weather is dry, scalp also becomes dry, so there is more scaling and flaking. So regular oiling and shampooing twice or thrice a week would do.
G. So yeah, Kirat, I think we've answered the same thing. Dandruff के बारे में पूछ रहे थे. Does Wi-Fi radiation has any effect on hair fall? I think you're talking of not just Wi-Fi. I think you're talking about the general radiation, which is mobile signals and all the other radioactive waves,
Yeah.
maybe.
Yeah, see, ultraviolet radiation does have a role in hair fall. but Wi-Fi, like this phone, this signals and all, I don't think they are having any much impact.
यस, सूरज निम्बाड़ी जी, बहुत ही अच्छा क्वेश्चन पूछा है इन्होंने। हाउ मच इज नॉर्मल हेयर फॉल? तो
Yeah.
या वी डू वरी अबाउट इट, थोड़ा ज्यादा स्ट्रेस हो जाते हैं, बट व्हाट इज नॉर्मल हेयर फॉल?
See, normally 50 to 100 hair fall per day is considered normal. Anything that goes beyond 100 hairs, so that hair fall is to be considered as abnormal.
Okay, okay.
So if you are
So
losing
here is
100 hairs per day, that is not something to be worried about.
okay. Pankaj, 37-year-old male है, tried Alpecin caffeine shampoo and liquid to control hair fall. It helped for a few months, but 2-3 times I brush my hair, but now again pillow is full of hair. Please help.
Yeah, caffeine and other topical preparations that he might have used for hair would definitely would have helped, but then you need to consult a dermatologist, because there is maintenance therapy also. First, to control or prevent hair fall, certain medications are given, and then for maintenance also one need to be visit dermatologist. So
जी,
maintenance
ललित
therapy.
कुमार जी पूछ रहे हैं कि yes, which is important to use certain things. Lalit ji is asking, I've been using minoxidil, which stops my hair fall, but if I discontinue, the shedding starts again. Is this something that I need to use lifelong to maintain the hair, or is there any other way?
Yeah, minoxidil, when it is used, it has better control for hair fall, but once it is withdrawn, then again chances of recurrence is there. So you need to decrease the strength of minoxidil and use. You should not withdraw all of sudden. So like if he is using 10 percentage, then if there is good control with that, then we need to switch to lower percentage formulations, and also it is like that.
Okay. Nitin Apurva is asking, does vitamin D deficiency reduce melanin pigment and thereby will it cause graying?
Yes. So there is role of vitamin D also. Yes. Whenever there is low vitamin D levels, it also causes hair fall and even graying of hairs. So taking vitamin D supplement is also essential, along with other biotin and other supplements.
Wow. So we talk about biotin and other keratin supplements, but we forget taking the
Yeah.
simplest of the simplest B vitamins. Good ma'am. Jayendra Singh ji is asking this question. ये थोड़े medications पे है जो hair fall induce किया है इनके केस में. Tamoxifen ultras induced hair fall and balding hair. Is this permanent? How can this be controlled?
Repeat the question.
Sorry, ma'am. टॉमॉक्सिफिन एंड अल्ट्राज इंड्यूस्ड हेयर फॉल है इनका एंड देन बॉल्डिंग भी शुरू हुआ है. इज दिस परमानेंट और हाउ कैन दिस बी कंट्रोल्ड?
Okay, so I think those formulations contain minoxidil only. So better to consult a dermatologist and then to go ahead.
ठीक है मैम. Yes, lifestyle. Amit Kulkarni ji, we just talked about the deficiency of vitamins and minerals and what you need to supplement. Yes. So alopecia के बारे में बहुत सारे पूछ रहे हैं. So let's talk about alopecia because the twice that you gave me information about alopecia. What is alopecia and what can we do to identify it and treat it?
Yeah. So, literally, the meaning of alopecia is hair fall or hair loss. So, as I already told, that it could be localized, it could be generalized. Localized, it could be a patch, like alopecia areata, or other conditions like trichotillomania, in which there is this psychiatric illness in which there is pulling of hair. Patient tries to pull off the hair, and generalize. It could be cicatricial or non-cicatricial. Cicatricial alopecia, in which there is due to repeated inflammation on the scalp, there is scarring, and there is fibrosis, so hair follicles are destroyed. So then hair regrowth is not possible. But in non-cicatricial alopecia, there is a smooth patch. Hair follicles are not destroyed. So when we are trying to give certain medication, topical as well as oral, the hair growth is possible. Or it could be generalized, like telogen effluvium, as I already mentioned. Then due to some chemotherapeutic drugs, like anti-cancer drugs and all, so there could be generalized hair loss.
Yeah. Ma'am, here's the next question relating to dandruff and other fungal infections on the scalp and then hair fall. राज सिंह पूछते हैं इनका बहुत हेयर फॉल हो रहा है, डैंड्रफ भी बहुत ज़्यादा है और उनको भी किसी भी शैम्पू यूज़ करने पर भी स्कैल्प क्लीन नहीं होता है. That's his problem. And also Kirat, what is the effect of dandruff on hair fall? How can we control dandruff? Then Anisa has fungal infection. Will hair fall happen because of this scalp fungal
Yes.
infection?
See, our hair contains a lot of sebaceous glands and sweat glands. So the sebum content that would favor the growth of fungi. So when there is excessive sebum production, either it could be due to environment humid, or if somebody is exercising more, or if somebody is perspiring more, then they will have more oily scalp. So that would favor the growth of fungus. So obviously, ketoconazole or zinc pyrethrum based shampoo will definitely help to control this dandruff.
Gee,
So in
thank you
that
so
case,
much.
yeah,
Yeah.
wash their hands daily.
Yes, and a lot of dandruff related questions. And yes. I was thinking, कोई अब तक ये question पूछा क्यों नहीं? Mr. Selim is asking this question. Does onion juice help in any way in hair loss or stopping hair loss?
Yes, yes. Onion juice contains sulfur, so it promotes the collagen synthesis. It also helps in hair growth. It promotes the growth of hair follicle. So it also has certain antibacterial properties. So it kills the germs. So it is helpful.
Yes, ma'am. So here, a lot of people are asking about, hair fall के लिए, but also there are a few questions about treatments and surgical procedures. Is hair fall, hair transplantation good? Will hair grow back? And also PRP के बारे में भी शायद मैंने दो तीन क्वेश्चन देखे थे मैम. अभी ऊपर चले गए. I'm sorry, I'll not be able to take your names, both of you. One has asked about hair transplant, and somebody else about the plasma.
Yeah, platelet rich plasma therapy. So yeah,
Yes.
along with medical treatment, surgical treatments are also there, like hair transplantation or platelet rich plasma therapy. So platelet rich plasma, in platelet rich plasma, the patient's own platelets are taken, and then they are infused onto scalp. So platelet is a very much good for, it contains growth factors that helps in the growth of hair. So it is advisable that those who are having such type of hair fall, which is not controlled just by medical sort of treatment, PRP could help. And hair transplantation, yes, if somebody wants to get growth of hairs over crown, and so it is very much advisable that they can go for hair transplant, in that the hairs are taken from the occipital area and they are placed at places where there is deficient hairs. So hair transplantation is also a good option.
But
Another
it's a
is
long,
also, yeah.
ma'am. That's not just like one stop, go and come back. It's also a longer wait period भी होता है ना उसका.
Yeah, it takes like 4 to 6 months.
Okay, so timeline is 4 to 6 months and then gradually.
Yeah,
और
gradually.
ये सब कौन करवा सकते हैं? I've also heard from one of my good friend that he went in to check if he can be transplanted, hair transplantation. पर डॉक्टर साहब ने उनको क्लियर मना कर दिया है कि यू आर वेस्टिंग योर मनी ऑन दिस, आपके तो ये सॉल्यूशन नहीं है. इज दैट ऑल्सो, इज इट ट्रू मैम?
Actually, they should meet a board certified dermatologist, because there are many other people also who just do hair transplantation and the results are not very much promising. So you should always visit a board certified dermatologist for any of your hair related queries.
Yes, Abhijit ji, I will take up your question, which will cover and everything towards the end. In the meanwhile, I want to take up Yograj Dhamade's question. 25-year-old male, for the last 2 years, he is losing his hair very rapidly, ma'am. Regrowth के बारे में चाहिए. Also, he has vitiligo on the face. Are these two conditions related?
Yes. See,
Oh,
vitiligo, and yes, there are certain autoimmune conditions in which there is which affects, because all these are pigment cells. So the skin, the pigment in the skin, and there is also pigment in the hair. So if a patient has vitiligo, it could there is also chance of alopecia areata over the scalp. So all these are autoimmune disorders. So there is definitely a link between these two, and we could just give them, multivitamins, and along with some hair peptides that would help in the regrowth of their hair.
Wonderful, ma'am. Thank you. आप बहुत elaborately आपने answer किया है, and a lot of questions were similar, so I could not take up names individually and the questions again because you have covered most of the topics earlier too. So I would request all the audience to please bear paucity of time. I cannot take all the questions, but I hope your question is answered and you will find a solution there. Dr. Pooja, let me conclude with Mr. Abhijit's question. He is asking, will please give us tips to help stop the hair fall and fast regrowth के बारे में. Top tips,
Okay.
please.
Yeah. So top tips for healthy hair are: you should always protect your hair from sun, wind, rain, ultraviolet radiation, because there is lot of dirt accumulation on scalp, so that would cause hair fall. And you should always use a gentle or mild shampoo along with conditioner to wash your hair. And you should never comb your hair when it is wet. And do not overuse hair products and hair treatments. And at bedtime you should always make your hair light, and you should not tie it very much tightly, so that there is less damage to the shaft of hair. And all these things would definitely help.
Yes, ma'am. Thank you so much. Before we take leave from you, ma'am, here's an interesting question. हम सब hair fall के बारे में worry हो रहे थे. We're all talking about hair growth. Karthik is asking, is laser hair removal recommended? So I definitely think it's not from the scalp, it's from other parts of the body. But
Yeah. See, laser hair removal is not the idea for gray hairs, because laser specifically targets the pigment hairs. So whenever we are doing laser hair removal, that is only for pigmented hair. That is for coarse and stiff hairs. That is not for gray or white hairs. It is not at all helpful.
wonderful, ma'am. Thank you, Dr. Pooja. So you gave me confidence of taking care of my diet, my nutrition, and my lifestyle. तो ये बाल
Yes.
जो बाहर दिखते हैं वो बाहर का चीज नहीं है, अंदर से उसको मैनेज करना है. दिस इज माय होम टेक अवे पॉइंट, मैम. Thank you. Lovely time that we had, ma'am. Thank you so much.
Thank you.
Thank you. So that was Dr. Pooja Solanki Vyas answering all the questions. Now it's your time to answer my questions. I'm going to ask you 3 questions. Health quiz coming up. And if you answer the right answers, and if our team selects you as the winner, I'm going to declare the winner's name towards the end of the show. And if you are declared as a winner, if I take your name as a winner, you have to write back to us with your contact details at marketing@apollo247.com. Gift vouchers from Apollo 247 will be shared with you. Chaliye, by the way, you have to answer your answers only in the YouTube chat box, okay? Wherever you're watching it, but only in the YouTube chat. चलिए, आज के 3 क्वेश्चन आपके स्क्रीन पर. The question number 1, answer true or false. Heredity, aging are the 2 prominent reasons for hair fall and graying. True or false? Next question number 2, fill in the blank please. Dash is the second fastest growing tissue in the body. What? Blank is what? Is the second fastest growing tissue in the body. Question number 3 and the last question. Where can you find health articles and resources in the Apollo 247 app? Where can you find health articles and resources in the Apollo 24/7 app? All right, these are the ones. You want me to repeat the questions? I'll quickly repeat them. Question number 1, true or false में answer कीजिए. Hereditary and aging are the 2 prominent reasons for hair fall and graying. True or false? Question number 2, fill in the blank. Dash or what is the second fastest growing tissue in the body? And question number 3, where can you find health articles and resources in the Apollo 24/7 app? ये थे आज के 3 सवाल, and I see a lot of people are answering. Wow. Karthik, Sean David, AB, Ishita, playlist name Jolly Singh, AK Sharma. Wow, a lot of people are answering. I will wait for our team to find the winners for today and then give the names to me. In the meanwhile, let me give you discount vouchers and coupons that you can use in Apollo 24/7 app. You have to download Apollo 24/7 app to use these coupons. The first coupon that we are giving away today is First VC. Direct from Apollo. अगर आप डॉक्टर कंसल्टेशंस करना चाहते हो, use this code on Apollo 24/7 First VC and get flat 150 rupees off on the first online doctor consultation. And the code is First VC. Apollo 24/7 download कीजिए and then you can use this there. And the next coupon that we give away is First 3. Order medicines direct from Apollo and get flat 25% off on online medicine orders. The code you have to use is First 3 on Apollo 24/7. So download कीजिए Apollo 24/7 and entire Apollo आपके हाथ में रहेगा. And also you can consult Dr. Pooja Solanki Vyas and also many other experts regarding your hair fall and graying issues as well. By the way, there's exclusive coupon which we give away every week for our Health Our viewers. And this is the exclusive coupon for our Health Our viewers, which is called HH247. The next coupon, please, on this HH247, you get 199 rupees off on online consultations with Apollo doctors and up to 20% off on medicine orders. This is an exclusive gift coupon that you can use on Apollo 24/7 in addition to the coupons that I have shared earlier. So go ahead, download Apollo 24/7. By the way, next week we are doing a very interesting session. Please join us there because we are going to talk about a very, very interesting subject. Is diabetes reversible? Management of diabetes is something, and can diabetes be reversed? This is a very important subject. And if you have anybody in your family who is going through diabetes, who is managing diabetes, and if you are going through diabetes, join us and ask your questions. This is going to be the next week's topic. We have 2 experts joining us. So you can ask, it's a double dhamaka session. It's going to be 18th September, 11 a.m. is going to be this live session. If you don't want to miss this, download Apollo 24/7 app or also subscribe our YouTube channel and also बेल आइकॉन दबा दीजिए जिसके वजह से आपको नोटिफिकेशंस भी मिलेंगे. And our winners of this week are, number 1, I have Karthik Singh, and number 2 position pay I am still yes, AK Sharma, Kirat and Karthik Singh. Congratulations, you are the winners for this week. Please write back to claim your gift vouchers from Apollo 24/7. So thank you, Dr. Pooja Solanki Vyas, for joining us live this Sunday, and also all the audience who have been very patient. Thank you once again. Namaskar. We'll see you next week.